Diabetes care, as most of us know, is critical in order to maintain a healthy and active lifestyle. And today's interactive expert talk will cover how one can prevent it from occurring and how those who have it can effectively control diabetes and avoid further complications. The expert at our talk today, you have heard him before, is Dr. Tausif Ahmed Thangalvadi. Thank you very much for being here. He is the medical director and general manager of NURA, the AI-enabled imaging and expert healthcare. A little bit about Silver Talkies before we move on to introduce Dr. Tausif and NURA. As most of you know, Silver Talkies is a social impact organization, and our mission has always been to make loneliness, social isolation, lack of engagement opportunities a non-issue for older adults, and to make active aging a desirable and viable goal for all. And we do that through events like these, through our website, which has our digital magazine, and through our community, which runs the Silver Talkies Club, which is a very vibrant, buzzing community and virtual now, so you can join it from anywhere in the world. So we'll be sharing all our credentials in the chat box very soon. And you can find out more about us. For those of you who are new to Silver Talkies, you can find out all about our social media, our website, and send us an email if you wish to know more and become a member. So to move on to today's expert, Dr. Tausif, like we told you, is the medical director and general manager of NURA. He has been associated with the specialty of emergency medicine for the last 18 years. He was also awarded the Emergency Physicians of India Star Award at PACE 2015 at YERCAD. And he has a profound love for teaching and has presented papers at various conferences across the world. He is an instructor for advanced trauma life support and advanced cardiac life support, among many others. He has worked in coordinating relief and rehab efforts during the Chennai floods, the devastating floods of December 2015, for which he was honored. Apart from being a doctor and definitely a lifesaver going by his credentials, he was also a radio jockey for 10 years, hosting a primetime show every day with two popular radio stations in Chennai, Fever 91.9 FM and Chennai Live 104.8 FM. NURA, as most of you know, is a collaboration between Fujifilm Healthcare and Dr. Kutti's Healthcare, bringing you the best of AI-enabled imaging and expert healthcare. This is a global movement they have brought to India, where the use of regular screening programs can actually help in preventing several ailments that could be avoidable. So without further ado, let's move on to today's event and hand over everything to Dr. Tausif. And just one Zoom etiquette reminder, as usual, kindly keep your mics on, audio on mute. And if you have any questions for Dr. Tausif, they're most welcome. Just put them on the chat box. We shall take them in the end of towards the end of the session. Thank you very much. Dr. Tausif, over to you.
Thank you, Rashmi. Thank you for the kind introduction. First off, to all of you, a warm welcome. Thank you so much. As always, I find the Silver Talkies community very vibrant and always ready to listen and keen. And I'm sure I can expect a few questions at the end of the lecture. Let me quickly share my screen and bring the presentation to you. Okay, there we have it. And yeah. Okay, so that's my presentation that's there. I hope everyone can see that.
Yes, it's visible.
All right, fantastic. The only thing I'll apologize for is that it's going to be a little content heavy. So, but I will try and make it as simplified as possible because there's no easy way to talk about diabetes. Yes. All right, so let's talk about diabetes. First and foremost, what is diabetes? Now, that's very, very important for us to find out what diabetes is. So let's see. Now, our body, diabetes is the oil that drives our two engines, glucose and energy. So when we take in food, that becomes glucose, and for that to get converted to energy, we need insulin. And this insulin is produced in an organ called pancreas. As you can see from the picture, the pancreas is located just below your stomach. It's a nice, quiet, little leafy organ, which is there, which has multiple functions that it does. It also produces enzymes for digestion, very powerful enzymes, but it also produces insulin, which helps us use our glucose and convert it to energy. So that's where the insulin is coming from. So the diabetes, there is insulin deficiency. So there is a drop in the level of insulin, but it is of two types. The picture that you're seeing is the insulin. That's how it looks as an amino acid, okay? Right, so type 1 versus type 2 diabetes. Now, what is the difference between these two types of diabetes? Now, if you notice, what really happens is in the healthy individual, when we eat food and there is glucose, insulin comes, and then there's a glucose receptor on the cell, which allows it to take up the glucose and use it for energy. In type 1 diabetes, the pancreas fails to produce insulin. So the glucose that is coming into the blood is not able to get inside the cell because the key, which we call as insulin, is not there to open the door and let the glucose into the cell. And in type 2 diabetes, the insulin that is produced is either insufficient, that is not enough, or the door is locked too tightly. The receptors are not responding to the insulin. Hence, we are not able to open the door. So that's what happens in type 2 diabetes. So basically, how does this happen? Why does this happen? In type 1 diabetes, there is destruction of the beta cells in the pancreas. So the insulin is not produced. Now, this can happen because of either an autoimmune disease or it can happen post any viral infection. In such a situation, the beta cells are dead and then there's no insulin produced. Whereas type 2 diabetes, there is reduced insulin production. And we'll come to that in detail a little later. So what really happens is if you take the blood of a type 1 diabetes and a type 2 diabetes, in the type 1 diabetes, as you see, there is no insulin. There's just glucose in the bloodstream. There's no insulin to push it inside the cell. But in type 2 diabetes, there is insulin and glucose, both are there, but the cells sometimes respond to the insulin or don't respond to the insulin. It's like a key that has become rusted. So you're not able to open the door with that key. So that's the problem in type 2 diabetes. So that in a quick nutshell is a difference. So here we go. So in a healthy individual, when they eat food, the pancreas will release insulin, and then that food will get taken up by the cells because of the presence of insulin. In type 1 diabetes, a person eats food, it goes into the bloodstream as glucose, but there is no insulin from the pancreas and the muscles cannot use it. In type 2, the muscle, there is insulin and there is food, but the muscle is not able to use the glucose because of insulin resistance. So that's what's happening. Okay. Type 1 diabetes is usually seen in early childhood. We get it in children itself, and people tend to seek medical help because they have high levels of glucose. So they come. But you can also find people with low blood sugar or hypoglycemia if they're already on insulin, and it cannot be prevented. So that's the problem with type 1 diabetes. But in type 2 diabetes, it can be prevented. It develops during adulthood, although today, because of bad lifestyle practices, bad genetic history, we're also seeing type 2 diabetes in children. And normally there's no hypoglycemia, but one can prevent type 2 diabetes. That's what's the most important thing. We can prevent or delay type 2 diabetes by maintaining a healthy lifestyle and diet. Also, regular exercise helps. So that is the meat of today's lecture. So healthy lifestyle, diet, monitoring can delay or prevent diabetes. And how are we going to do that? So let's first look at the big problem, the burden of diabetes in the world. How big is this problem? Okay, look at this map. Okay, now in this map, the red color areas or the orange color areas, I'm not very good with colors. So those areas are the ones which have the highest amount of diabetics in the world. And what color is India? It is red. So China, India, they account for the largest population of diabetes in the world. Nearly 1/3 of the diabetic population in the world is in India and China. China is ahead of us in numbers, about 110 million, but it is predicted that India will soon overtake China. Even as early as 2030, we will overtake China as the diabetic capital of the world. Now let's look at how we have grown from 1980 to 2014. Yes, the world has grown, and we are having a total growth of 8.5%, 108 million in 1980 to 422 million currently. But our region, is also growing. Yes, so that's also growing as well, right? So let's look at what is predicted for the future. What will happen in 2045? The burden of diabetes in the world will increase by 51%. But if you notice Southeast Asia, that is going to grow by 74%, more than the global average. So we are going to beat the global average Of course, we have Africa and the Middle East, which will beat us, but that's not something that we need to be proud about. We are going to be higher than the global average, and there's going to be a lot of diabetics in our country. What about India? Let's look at India. Okay, so these two pictures, one is from 1990, the blue color one, and the other one is from 2016. And you can see from where we were light blue to dark blue in 2016, we've become all red. That means the amount of diabetics are growing, especially Tamil Nadu, Kerala, Andhra, Telangana. Karnataka, thankfully, seems to be still in the light blue, so it seems all right. But the rest of the country is definitely going the diabetic way, which is not very, very good for us. So if we look at the statistics, 77 million people with diabetes is what we have right now. Okay, that's 7 crores, 7.8 crores is the current count. But by 2045, it's going to be more than 13 crores. We're going to almost double in that time, in 20 years. And the worst part, which I want you to focus on, is this. 43.9 million people, that is 4 crores, are undiagnosed. We don't even know that they have diabetes. And since we work at a screening center, we have noticed a lot of people come in and then feel very surprised when they diagnose diabetes in them. But it helps them then control it, then work with their life and avoid complications. Also, right next to it, there's a box which says national prevalence of diabetes is 8.9%. That means if you take 100 people in India, 9 of them will have diabetes. And I'll show you where Bangalore stands at that, okay? So total healthcare expenditure on diabetes in India was estimated at $31 billion in 2017. That's a large amount of money, many thousand crores, if I'm not wrong. Now, we generally tend to think that diabetes develops at a certain age and then it grows as we go. But I want to let you know that diabetes can also be diagnosed really late in life. People who are above 60 years old also may develop diabetes. So it's not just that, okay, if they're young and at the age of 40 or 50, they'll develop diabetes. People grow older and never had diabetes can also develop diabetes later in age. In fact, when we initially started diagnosing diabetes, it was in the later age group, the older age group. And then over time, we've been seeing diabetes more and more in the younger age group. So that's what's happening. And of course, this is what I wanted you to see. I told you the national average was 9%, but in Ernakulam, Kochi, and Chennai are definitely higher than that. Hyderabad, Trivandrum, Bangalore is also higher than the national average. Yes, Bangalore is also showing a 12.4% average diabetic rate. So 100 people, if you pick up in Bangalore, at least 12 to 13 people are going to be diabetics, whereas the national average is only about 9 people. So Bangalore is still on the higher side. And of course, there are so many other cities in India. Okay, the good news though is 10% only are type 1 diabetics, 90% are type 2 diabetics. And why am I saying it's a good news? Because it can be prevented. So we can prevent type 2 diabetes or control type 2 diabetes. So all of that we will discuss about healthy and balanced eating, appropriate body weight, and so on as we go further in the presentation. So that's the good news that we have. So let's focus on type 2 diabetes. It's a multifold problem that is happening. Okay, we're taking food, the glucose level is going on, glucose is getting produced by the liver as well, but there is no insulin for it to be able to push it into the cell. So our blood glucose level goes up, and that's what leads to problem in type 2 diabetes. Okay, so what are the risk factors for developing or having type 2 diabetes? So there are some risk factors that we cannot do anything about. For instance, somebody who during pregnancy develops diabetes, gestational diabetes, okay? There's nothing we can do about it. Maybe we can give insulin to the person, but their chance of developing diabetes later on in life is close to 10%. So anywhere between 5 to 10% risk is there for every pregnant woman who develops gestational diabetes. And also the fetus, the baby that was born during the gestational diabetes has a 1 to 5% risk of developing diabetes as they grow up. So yes, so if a child was part of a gestational diabetic pregnancy, then the risk of that child developing diabetes later on in life is 1 to 5%. And we cannot do anything about it. We cannot change that, unfortunately. Also, race, ethnic background, people who are dark skinned, dark colored, they seem to have more tendency towards diabetes. And in fact, Hispanics, Spanish people, Latin American people, they also have a higher tendency towards diabetes. Age above 45 years, that's because the majority of the cases of diabetes happen after the age of 45 years. So that is another factor that we cannot modify. So it's in our best interest that as we grow older, we control our sugars more and more and monitor it better. And family history of diabetes. Yes, if somebody in the family has already had, like a parent or a brother or an aunt and uncle, then there is a chance that that person is prone for developing diabetes later on in life. But there are factors that can be modified. Physical inactivity. Make sure that nobody is physically inactive, because the more physically inactive someone is, the higher the risk of developing diabetes. High body fat or body weight. So being overweight is definitely, it's like a calling card for diabetes. So people who are overweight can then go on and have this problem of diabetes. If we don't control our blood pressure, or we live in a very stressful environment, that can also push us towards diabetes, because guess what? Our response to stress is a fight or flight. Fight or flight means a lot of glucose is going to be in your blood because you want to either run or start a fight with somebody. So that way your glucose is constantly pushed up, and then the risk of getting diabetes also goes up. And then cholesterol. So make sure the cholesterol is also in control. Otherwise, there is a higher risk of developing diabetes in these people. So know these risk factors. Not knowing this is a crime. So you must know about body weight, high fat, being physically active, cholesterol, blood pressure. All of this can be reduced. So you must know this, because this is where you can work on and make sure that the diabetes is under control. Right. Is it a disease of the elderly? We tend to think, oh, it's only in older people, younger people are not going to get it. That is not true. Yes, a large majority of diabetes occurs in the age group of 40 and beyond, and all the blue lines are men and all the green lines are women. But it also can occur in the younger age group. So there's a 5% prevalence in 30 to 34, 2.5% prevalence in 25 to 29. Even less than that, we still have diabetes prevalent in 20 to 24. Well, of course, our lifestyle, our habits, the food that we eat, all of this can be influencing diabetes. I mean, right now I'm having French fries in front of me, and that's not a good food to have, if you want to control your risk of diabetes. So all of this junk food is definitely not right. So yes, it is not just a disease of the elderly. So symptoms and signs of diabetes. Some of you may already know these symptoms and signs, but let's do a quick review and see what symptoms and signs we're looking for. So first, there is weight loss. Now, why is this weight loss happening? Why should there be weight loss? The sugar is on the higher side. Should they not be putting on weight? And you're saying in an overweight person, already diabetes risk is there. So why should there be weight loss? So let's say in diabetes, the sugar level is going up in the blood, but the tissue or the muscle is not able to take in that sugar. So then the body says, I need more sugar. And the easiest source of sugar for the body, apart from the liver, is the muscle. So the person's muscle will start getting broken down to create more sugar for the body. So that is why they start undergoing weight loss. Basically, it's muscle wasting, which is not a good thing for the person. So that's where the weight loss starts. Then they're always tired because there's no glucose, no energy, no insulin. So they're going to be always tired. Then there are wounds that won't heal. Why do these wounds not heal? Because sugar is a good medium for bacteria to grow. So as there is a wound, the bacteria goes and keeps on irritating, risk of infections develop, and then it also doesn't allow it to heal because all the tissues become sluggish. If we become overweight, we become very lazy. We're not able to do a lot of physical activity. The same thing is with our immune system, our healing system, everything becomes lazy. We're always thirsty. Why? Because we are passing a lot of urine, which is loaded with sugar, and that makes us thirsty, and we're always drinking water. Blurry vision. If the sugar is getting deposited in the retina, then there can be a lot of blurry vision that's happening, or there's a cataract. There's also numbness and tingling in the hands or feet. Why? Because the sugar is then getting deposited in the nerves. So then the nerves start, crying out, saying, "Hey, why? I don't need sugar. Why is there sugar in me?" Right? And yes, somebody's always hungry. They want to keep eating because whatever they're eating is not getting utilized by the muscles. And of course, there can be sexual dysfunction as well, which is also a side effect of diabetes. So these are some of the common symptoms of diabetes. Of course, this can then become worse. There can be skin patches that we will see. We'll have dry feet, and then there can be ulcers that can happen. The blood pressure will go up. They're bleeding in the eye, neurological problems where they'll have strokes, and also slow deterioration of all their sensations. It will start coming down. The people won't be able to feel their slippers. That's the most common sensory loss that they have. They're not able to hold on to their slippers when they're wearing it. Okay, so these all can happen in diabetes. So if anybody notices these symptoms, it's best to get their sugar checked. Always feeling tired, suddenly there's a weight loss, a lot of urine, a lot of hunger, thirst, everything is there. Yes, please check the sugars. Okay, how do doctors diagnose diabetes? Now, this is very, very technical. Yeah. Apart from these symptoms of overeating, excessive thirst, and passing a lot of urine, we check at any point of time anybody's sugar, and it's above 200, then they're definitely diabetics. Okay, so there's no two ways about it. Anytime anyone checks their sugar and it's above 200, they are a diabetic. A non-diabetic sugar will never go up above 200. So that's the magic number that you need to remember. So let's leave all of that and then make it into more simpler numbers like this. So what we generally tend to check is HbA1c, a fasting glucose, and postprandial, what we want to check. So normally the HbA1c is about 5.5, not 5.5, 5.6, or less than that, not 5. 4.5, 5.6. A fasting glucose can be anywhere less than 110. We are fine. Not 100 is a little too low. Or less than 110 is normal for all of us. And then if we do it after meals, 2 hours later, it should not be more than 140. It should be less than 140. Some people, it's not at this range. Some people, it goes up to 5.7 to 6.4, the HbA1c. Then the fasting can be between 110 to 126 or 125. And then postprandial, it can be 140 to 200. These people are pre-diabetic. If they don't control their sugars or what they eat and do exercise, their risk of developing diabetes is very, very strong. They will become diabetic soon enough. But if you check and the HbA1c is above 6.5, fasting is above 126, and postprandial or after meal is above 200, then they're definitely diabetics. They need to be on medications. There's no point in being in denial and saying, oh, I'm not going to take medications. I'm going to try and do diet control. It's not going to help you. It may worsen the situation. So please get on medications if this is the number that you're going to see. In between, when there is a pre-diabetes, yes, diet control, exercise, modification of the lifestyle, everything will help. Okay. So that's how we doctors diagnose diabetes, and now you also can do that. Can I prevent or delay onset of diabetes? This is the meat of what we really want to discuss about here today. Yes, we can. That's the good news, especially type 2 diabetics. Definitely we can. The first thing you must do is monitor and or lower your blood pressure and cholesterol. Again, this is a 6-step approach, but let's stay with the green slide. Green photo, monitor and lower your blood pressure and cholesterol. That's number one. So make sure your blood pressure is monitored, your cholesterol is monitored, and you're not doing anything to push either of those up. Make sure you have physical activity, at least 30 minutes per day and 5 days a week. So in total, that will be 150 minutes of physical activity a week. If you're a younger person, then you can do moderate activity, moderate exercise, a bit of jogging, brisk walking, weightlifting. But if you're an older person, just activity is enough. You don't need to do running and so on, but activity, walking as much as you can itself will reduce your risk of diabetes by 58%. So that's very, very important. Also manage your weight. Make sure you don't become overweight. Your BMI is less. The normal BMI is about 25. And if you stay within that range, your risk of diabetes is going to be very, very low. But if you're a little higher up, then yes, you can go towards pre-diabetes. Okay, that's the number. And eat a healthy diet. Lots of fruits, very less fat, more fiber. When you eat more fiber, it will take away everything that's bad from your intestines and bring it out. Whole grain, again, a lot of vegetables, fruits, and lean meat, okay, because red meat is going to increase the cholesterol again and then push towards diabetes. So all of this can prevent or delay onset of diabetes. And of course, if there's a smoking habit, please stop the smoking habit. Alcohol, again, there's a lot of barley, there's a lot of carbohydrates in alcohol, and it will push people towards diabetes. Soft drinks, again, a lot of sugar in soft drinks, that is a strict no-no. And yes, if you have a tea or coffee drinking habit, no sugar in that, okay? So all of this can really, really help. So this is really the slide that you want to focus on and keep in mind and make sure everyone who has diabetes is following it. What about monitoring? What about monitoring and controlling sugars? What do we do about that? Well, these are the following things you must monitor. First and foremost, your glucose. When I say glucose, it's not your fasting sugar and your postprandial or after meal sugar. It's not that. When I say glucose, there's something called as HbA1c. If you're wondering what is HbA1c, HbA1c is the glucose that is sitting on your red blood cell, on your RBC. When we see anemia hemoglobin that we check, that's where it's sitting. Okay, so it's a glycosylated hemoglobin. That means your RBCs are also very, very slow and sluggish. The life of the RBC is about 3 to 4 months. So if you have a high HbA1c in your blood, that means since the last 3 months, your sugar is not under control. So you must control your sugars, okay? So that's the HbA1c. And as I've shown in the slide, the more you control, the less risk you have of any complication, death, heart attacks, everything keeps going down, strokes, microvascular disease, all of that goes down. The next thing is blood pressure. Make sure your blood pressure is always under control, because if you control your blood pressure, again, the same factors come down, adverse effects, complications, heart attack, stroke, everything comes down if a diabetic controls the blood pressure. An ideal blood pressure control for a diabetic will be somewhere between 130-80, right? You say 140/90, 130/80 or 130/70 is a good blood pressure for any diabetic. Sometimes for diabetics, doctors will start blood pressure medication even if they don't have high BP to make sure the blood pressure is under control. So that's not a bad thing at all. Okay, lipid profile, cholesterol. So you must keep your cholesterol under check. And this is a lot of data, but basically if your cholesterol, LDL, as we say, your total cholesterol is more than 135, then we will try to give you statins like atorvastatin, rosuvastatin. So they will give those statins to make sure we try and bring it as low as possible. So cholesterol is not the friend of a diabetic because they'll have more adverse events if they do. Okay, let's move on. Ulcers. Now make sure that, because some people cannot feel sensations on their feet, they have a risk of developing injuries and ulcers. So keep checking because these can become infected. And before we know it, people end up losing their foot or feet or, getting amputations. So it's best to keep checking for ulcers regularly because the diabetic will not tell you that they have ulcers because they cannot feel it. There is no pain. Okay, so they're not going to feel it. So please keep checking. Right, and check for risk of complications. So there are many complications related to diabetes if you don't control it, like heart attacks, kidney dysfunction, strokes that will affect the brain, vision loss because of cataract and retinopathy, peripheral vascular disease where there is decreased blood supply to the legs, and people are not able to feel any sensation because of that, or neuropathy for that matter. So these are all things that we must monitor for if somebody is a diabetic. Okay, can NURA help? What do we do? So ultimately, what is that we can help you with? So let's look at what NURA does. NURA, of course, many of you have heard this lecture before, is the Japanese way of advanced full body health screening center. So we make sure we screen everyone for common cancers and also major lifestyle diseases. So we are able to tell people, one, if they have the disease or not. Two, if there is something that can push them towards the disease, it's best to get it treated early. Or three, we reassure them that they are in perfectly good health. So this is what we do at NURA. In relation to diabetes, at NURA, we can help you check the following. First, we can do your HbA1c, which should be done every 3 months. I mean, of course, NURA, we tell you come once a year and we check everything for you. But if you're a diabetic, at least once in 3 months, you must check HbA1c. Blood pressure, yes, we check your blood pressure as well. We also check for infections because we do a complete blood count and then we see if there is any rise in that. So we will check that as well. We also look at your kidney health. And here at NURA, we do something called as GFR or glomerular filtration rate. So it's not just creatinine, but actually how much your kidney is filtering the blood that is passing through it. We also monitor your lipids and your cholesterol. The best thing is that all this is a non-fasting test, and that's how we check the blood pressure. That's also digital. So you don't have to be in fasting when you come for checking this. Okay, you can just come in, even like say in the middle of your office, you said, okay, I have 2 hours free time. I want to go to NURA. You can walk in and get all of this checked. So we don't ask you to fast and then come. Okay, so it's normal. You can have your meal and then come to NURA to get testing done. Also, we check for visceral fat. Now, what is visceral fat? Visceral fat is the fat that's present inside your abdomen, not outside. What we see as fat is only that blue color on the screen is only the outside fat. Sometimes people with more outside fat can have very little visceral fat or inside fat. Sometimes people with very little outside or external fat will have a lot of visceral fat, like this gentleman who has very little external fat, but his visceral fat area is nearly 200 centimeters and the normal is less than 100 centimeters. When we check for Japanese, usually it's less than 100. When we check for Indians, it's usually more than 100. Unfortunately, we don't focus too much on visceral fat. What will this do? It will put pressure on all the organs in the abdomen, including the pancreas, the liver, fatty liver, the intestine. So digestion will not happen. Risk of diabetes is going to be very, very high. And long-term risk of colon cancer is also there if the visceral fat is very, very high. So we must be careful about the visceral fat as well. Of course, we also help you by looking at heart calcium scoring. So heart calcium scoring, and we've had surprises. Unfortunately, I don't know how many of you heard the news. We lost a very popular Kannada actor today. He was only 46 years old, a very healthy young man. His name is Puneet Rajkumar, and regularly going to the gym and working out. Had a massive heart attack today and passed away. Really condolences to the family, but that is why we do a heart calcium scoring, because we can look at for any blocks in the coronary arteries. And this is the same gentleman that I showed the visceral fat for. He had no history of heart disease, no family history. He used to work, do 30 minutes of walking every day. But this is what we found in his coronary artery, in his blood vessel. This allows us to make sure that such nasty surprises are avoided. And I have a very personal experience which happened between the 21st and 25th of this month, like October. My own uncle had some throat pain radiating to the hand. And my cousin, who's a general practitioner, saw him and said, go to Tausif, they're doing screening for the heart, the blood vessels. So he said he came in and there were 3 blocks that we found. And this man had an ECG that was normal, a tropi blood test that was normal, and never had an abnormal ECG. So we insisted on getting an angiogram for him. We saw a cardiologist, and he had 99% block in one artery. He's getting posted for a bypass surgery soon, right? So that's a very personal story that happened to me, and I was also very, very taken aback by it. But that's where we help. We are able to help and prevent such nasty surprises as happened with the actor. But yes, diabetics are more prone for this. So yeah, diabetics must get checked for this as well. And there's so much more that we do. We look at metabolic syndrome. We're planning to add ECG. We're planning to do an abdominal scan as well as we go eye testing. All of this we're going to add as we go through in NURA. And this is how we present it as a report card. We show all of this to our guests. We have these 5 cancers for women and also the other 10, 11 parameters that we do in everyone. For men, we do 4 cancers. So this is how we check at NURA. We make sure that the risk of developing diabetes, which is metabolic syndrome, which is a part of metabolic syndrome, is low or high in somebody. And we can advise them accordingly as to what diet modification, lifestyle modification they must undergo to avoid developing the disease. Okay, any questions? Okay, I'm going to come to the questions in the end. So I'm going to summarize. Diabetes is growing rapidly across the world. And type 2 diabetes accounts for 90% of the cases, which is good because type 2 diabetes can be delayed or even prevented from developing, which is the best thing. A healthy lifestyle with good exercise, diet, and monitoring is key to strike the disease before it strikes you. And that's Wasim Akram. I don't know how many of you know, but Wasim Akram is a type 1 diabetes mellitus. All his playing career, he would take insulin. So if you noticed, every time he would be bowling, he will go out, have some chocolate, and he'll come back because his sugars will go down. But he managed to have a fantastic career. And for the longest time, he was the highest wicket taker in one-day internationals until Muthaiya Muralidharan beat him. But he's a big, big brand ambassador for diabetes. And everywhere he goes, he actually talks to people about diabetes. So that is probably the most popular sports person ambassador for diabetes in the world. And we can take his example. He's lived his entire life with diabetes and healthy and performed amazingly well. So we should take him as a good role model. Well, this is us at NURA. We will never stop. We keep innovating solutions for a better world. And we encourage you to choose health with us at NURA. Thank you.
Thank you very much, Dr. Tausif. We'll go to the questions now. I do see some in the chat box.
Sorry, I'm trying to stop sharing.
Okay, no problem. We'll give you, let's take your time.
Yeah. Okay, yeah, done. Thank you.
So there's a question from Ramana. Are the blood test levels in the chart with medication or without medication?
The blood levels always have to be done with medication. And I must tell a lot of people this. So do not skip your medication when you're going for your blood test, because it tells us, in spite of taking the blood, the medications, how is your sugar? I mean, along with it, rather, I shouldn't say in spite of, that's the wrong word. But when you are being supported by medications, what is your blood sugar level? And that's what we want to check, because then we can know whether we should change the medication or increase the dose or decrease the dose. If you stop your medication and that day your sugar shoots up, I as a doctor am going to think the medication is not working and I'm going to increase the dose, or change the medicine. So then never do that. Always continue your regular medications when you go for your blood test. Never stop, whether it be your BP medication or your sugar medication or any other medication that you're taking. Don't stop it.
Okay, that's good for all of us to know. There's a question from somebody. How does smoking lead to diabetes?
So smoking is a really, really bad disease. A cigarette has about 5,000 chemicals, 4,000, okay? 4,000 chemicals that it has. And to date, we still don't know how many of them are carcinogenic, as in they can produce cancer. We definitely do know that it hardens blood vessels. Okay, so smoking hardens the blood vessels, which makes the blood pressure go up. When the pressure is high, you're going to have more injury to the blood vessels. And then the diabetics who are eating and then the sugars are going high, they produce a lot of cholesterol. This is going to get deposited and the risk of heart attack is going to go up for smokers. Can it damage the pancreas by itself? It can. It's just that we don't have concrete information on that. And if it damages the pancreas, then the person is going to get diabetes, because it will also induce acidity. So it is a stimulant. It will stimulate the pancreas to secrete the digestive juices. A lot of smokers have this habit that after food, they want to go and smoke, because that secretes digestive juices and triggers the pancreas. So when it's triggering the pancreas, it will also trigger the pancreas to produce insulin, thereby using up the stores of insulin that somebody may have. It may damage the pancreas also, and therefore cause diabetes. There's no exact, cellular level biology that I can talk about, but yes, this is one of the hypotheses that how this can happen.
What are the pharmacological and non-pharmacological methods to control postprandial blood sugar?
The part of the first question without getting too technical. So there are medicines that sensitize the cells to insulin. So what happens is when we eat food, the body is supposed to produce insulin. That's a trigger. As the glucose level goes up, the body is triggered to produce insulin. But in type 2 diabetics, the problem is this cell is not sensitive to insulin. The door or the lock is rusted, so we're not able to open. So there are drugs which act like oil. It will go and make sure that the receptor becomes sensitive to insulin. So when we read about, for instance, metformin is a good example for that. The glitazones are a good example for that. So these kind of drugs, they sensitize the cell. So that you have to take after food. It's very obvious. There's also drugs which avoid glucose absorption from the blood, like Voglukos. That you have to take with food at the same time. So it will not allow too much of glucose. But there are drugs which push insulin to be secreted from the pancreas. They have to be taken before food, like insulin. Yes, insulin and other tablets, sulfonylureas, we take before food to help secrete insulin. So without getting too technical, that's in a nutshell what medications we use. Non-pharmacological interventions, I already told you. First is monitoring. Make sure we know our sugars, we know our blood pressure, we know our cholesterol. Based on that, make sure our diet is very, very carefully watched. We don't indulge in a lot of sugars. We don't indulge in a lot of cholesterol or anything that will push our cholesterol and our blood pressure up. So those two things are very, very important. The third thing is exercise. The more we exercise, the more our cells become sensitive to insulin. So we can reduce our medication if we actually exercise every day, because that does half the job of the medicines that we're using. So more exercise, more and more and more. So as much as you exercise is better. Third thing is reduce your waistline. So the bigger the tummy, the more resistant are the cells. The lesser the tummy, the less resistant are the cells, or more sensitive they become as the tummy size decreases. So, and then of course, keep a careful watch on your body, look for ulcers, look for signs of infection. All of this have to be looked for to make sure that the diabetic avoids unnecessary complications. So these are some of the non-pharmacological interventions we do for diabetics. Hope that answers the question. Both parts.
Yes, we hope it answered your question. Yeah. It certainly did for us. Geeta has asked, would you recommend eating millets mostly as the carbohydrate? Eating millets.
See, it's more than the, millets are good. Millets are definitely good. Yes. Okay. They're definitely good. Why? Because there is a delayed release of carbohydrates, unlike rice. Rice will immediately give you a carbohydrate high. So it's like I came to the store to buy every month, supposing I'm getting 10 rupees from my father to go and buy chocolates. And I want to buy 10 rupees worth of chocolates. But then suddenly I decided, the shopkeeper says, I will give you this much for 10. Suddenly he gives me 20 rupees worth of chocolates for 10. Oh, I'm going to be overfed. I don't know what to do with those chocolates. I'm going to stuff myself with those chocolates. It's the same thing with meals. Rice is going to give you 20 rupees worth of chocolates, and you don't have enough insulin for that. You don't have enough money for that. But millets will give you slow release. So you'll have 10 rupees worth of chocolate coming in and then slowly going like that, right? So that way your insulin and your carbohydrates are able to match each other. Whereas with rice, they're not able to match. But you can still have rice, but reduce the quantity. Make sure it's only 10 rupees worth of rice. So I'm using the 10 rupee analogy, but yeah, it's just a metaphor. So make sure you have enough rice only as you need. Your calorie requirement is carefully met. Like at NURA, we also do a DEXA scan for you, and we can actually tell you what is your calorie requirement every day. So you can adjust your diet based on that, looking at what we suggest to you is your calorie requirement. And And that's a real time. That's like looking at actually how much muscle and fat you have. It's not a guess based on your height and weight. It is an actual real-time scan which says, oh, you have this much muscle, so you'll be burning this much calories, so you can take this much calories. If you match it, it's great for you. So yes, millets are better than rice for sure, but it's not like you have to stop rice, just reduce the quantity.
Okay, thank you for that. Where in Bangalore can we get diabetes screening done? Well, you have shared details of NURA.
You can, yes, come to NURA. We do a little more, a little extra. Anybody can check for HbA1c, but we do a little more. We look at visceral fat, we look at heart calcium. We also look, like I said, DEXA scan to tell your real-time calorie. So that's much better information, or much more information to have for you to be able to change your lifestyle appropriately.
Okay. Shakuntala has asked, I have heard some people say that all fruits are bad for pre-diabetes, but fat is good. Is that right?
Oh, no. Yeah, we are now in this keto diet phase. Everybody eats keto diet. I'm going to lose. No, see, any day a balanced diet is better. A balanced diet wherein you have 80% of your calories coming from your carbohydrates and proteins, and about 20 to 30% coming from your fat. If you heard that. So that's what you need to do. We know already on school, they've already taught us that 1 gram of carbohydrate will give us 4 kilocalories, and also 1 gram of protein will give 4 kilocalories, but fat will give us 9 kilocalories. So based on that, you have to reduce where you get your calories from. So if you are getting about 500 calories per meal, make sure 200 is from carbohydrate, 200 is from protein, and 100 is coming from fat. So that's how you distribute it. And fruits, again, it depends on which fruit you're taking. If you're taking a mango or a banana, that's a quick sugar high. It's going to rise and you're not going to have enough insulin to handle that. But if you eat apples, and certain like guavas, it's not going to rise that fast. And you can then, handle a bit of that. So take half an apple every day. You should be all right. Yeah. Whether you're a pre-diabetic or a diabetic, doesn't matter. A pre-diabetic, diet control and exercise will help you roll back and become a non-diabetic. So you can try that.
So the next
my brother's an example.
Sorry.
Yeah. My brother's an example. My elder brother at 42, he discovered that he was a pre-diabetic, started exercising, and now he's non-diabetic. So yeah, we've got examples all around us.
Absolutely, which makes it possible and inspiring for everybody. So again, similar question on diet. Does reducing carbs and increasing fructose help in controlling diabetes? Similar to what you said.
Yes, yes, it does. As in, like, if you take glucose sources versus fructose sources, yes, fructose is slowly released into the system. It's not going to push your sugars really high so soon, but yeah, glucose will be quickly reached, and then, it will use your insulin. But we can't survive on fruits all the time, yes? Some special people can, but not all of us can. Yeah.
Yeah, that's true. So balanced diet it is. So this is
Yes.
a question. I'll put together 2 questions which have come on replacing honey or jaggery for sugar. And if it's jaggery, then how many spoons should it be? And can a diabetic consume these?
Yes, any day compared to refined sugar, natural sources of sugar like fruits or jaggery is better. Not so sure about honey. Okay, really not so sure about honey, because it can still push your sugars up. But yes, for jaggery, yeah. And be aware that when we say jaggery, it is called as palm sugar or cane sugar, not brown sugar. Brown sugar is even worse than white sugar. So don't go to the store and buy that expensive brown sugar thinking it's better for your health. It's not. Okay, it is again processed white sugar, refined sugar that comes back as brown sugar because it's got molasses in it, and that's even higher sugar content. So palm sugar or cane sugar, which is not easily available. I think nowadays one of the pharmacy stores are marketing it, and you can get it from them as well. But you have to look for palm sugar or cane sugar. That is your jaggery sugar, not the brown sugar. Brown sugar is bad. Okay, just information for everyone to know.
Yes, and important information, because many of these have hidden sugars, like you said. So Rajiv has, he's shared his experience. There's no question really in it. I experience intense scratching on scalp, legs, abdomen, elbows, etc. It increases when sugar is high. Hot water bath gives relief. Many medicines with skin specialist hasn't worked for the last 2 years. There's no question attached. I'm just reading it out in case you have any advice.
Yeah, that means Rajiv could have neuropathy. Neuropathy is where the nerves are crying out and saying, help us, we are getting troubled by the sugar, right? So that can present as various abnormal sensations across the body, like tingling, numbness, sometimes itching as well. This is, of course, if you're ruling out the presence of fungal infections. Fungal infections, number one, should be ruled out because they're very common in diabetics. So the dermatologist might have treated him for that. But if it's still persisting in spite of that, then we're looking at a neuropathy. The only way to control neuropathy is control sugars. Have a very, very tight control of the sugars. Otherwise, it will worsen, and then there is no cure for that, unfortunately, for neuropathy. So make sure the sugars are under very, very tight control. That's very important.
Okay, we hope you heard that, Rajiv. From Subhadra, what should be the LDL and HDL for a pre-diabetic?
Whether it's a pre-diabetic, non-diabetic, or diabetic, the HDL should be above 50 because it's good cholesterol. What it does is whatever cholesterol is deposited in the blood vessel, it will bring it back to the liver to get more metabolized. The LDL should be touching near 100. You don't want it to be above 110, and you want to be closer to 100. The newer guidelines are saying less than 100, but it's very difficult. That means I will have to cut out oil and from my food all completely, which is very difficult for us to do. But yes, it should be nearer 100. The closer to 100 that LDL is, the better. The more above 50 that HDL is, the better. So HDL has to be high, LDL has to be low.
Okay. From Sunil, is eating wheat as in chapatis really better than eating rice?
Not really. I mean, it's the same. It's again the same quantity. So yeah, it's just newer concepts. Oh, eat wheat. It gets metabolized slower and later. Not really. It's the same. Just maybe a slower glycemic index for wheat than for sugar. I mean, so rice. But it's okay. It's not too much of a significant difference. So you can have your rice. Like I said, it's only about the quantity. Yes, rather than between wheat and rice. If you have too much of rice, then yes, it is going to give you a high sugar quickly. That's a good, high glycemic index. Wheat, lesser glycemic index than rice, but it still can shoot up your sugar depending on the quantity that you eat of chapatis, if you're thinking about chapatis. So it's the quantity. It's not about rice or wheat. It's about the quantity.
So, a couple of questions on sweetener for tea or coffee. One of them is fructose powder as a sweetener for tea or coffee? And again, similar question on Jaggery. So you could probably just give a comprehensive reply.
Yes, definitely anything other than refined sugar is a better alternative. Using white sugar, brown sugar, they're not good. Anything other than white or brown sugar is better, like cane sugar, palm sugar. I don't know about fructose powder. If that's available, sure, why not? That's also good. I haven't had it till now, so I can't really comment on that. But yeah, Jaggery is definitely better than refined sugar. So you're okay with that. But again, it depends on your sugar level. If you're not controlling your sugars and you're saying, I'm going to just have Jaggery and my sugar is going to be fine, it's not. At the end of the day, it's all sugar. It's about the quantity that you take and the sugar control that you maintain. So just changing something in your diet will not help if you're not controlling your sugars.
All right, thank you. Mr. Bhatt wants to know, once insulin starts, can we change to oral drugs?
It depends on why the insulin was started. So in the life cycle of diabetes, we go from insulin resistance to insulin deficiency. Insulin resistance means our cells are not able to respond to the insulin that is there in our body. Insulin deficiency means there is no insulin in our body. So if somebody who started on insulin after being for a long period on medicines, on tablets, and then he needed insulin, that means they have gone into that cycle where from insulin resistance, they went into insulin deficiency. Then we cannot stop insulin for them because they need it. The body does not have any more insulin to produce. But if somebody was started on insulin during a period of stress, like they were on medicines and unfortunately they went through an infection and they were in the hospital, at that point, the doctor could have started insulin temporarily to control the crisis. Once the crisis settles, once the infection settles, then we can take them off the insulin. We don't need to keep them on insulin. A very good example is COVID-19. So we had a lot of people with COVID-19 who were on steroids, who needed insulin temporarily. Once they recovered and the steroids were stopped, we stopped the insulin as well. We didn't continue the insulin for these people. So that's a good example for us to give.
All right, thank you. Mr. Jambunathan wanted to know, can a person have neuropathy without any diabetic disease?
Yes, there are other causes of neuropathy other than diabetes. Yes. So these peripheral neuropathies can be due to vitamin deficiencies, alcohol, and quite a few other problems that people can have neuropathies because of infections also sometimes. Not necessarily diabetes, but diabetes is the most common. The other neuropathies we find out reasonably immediately when they occur, but diabetes is slow and irreversible. Once the neuropathy or diabetes comes in, we cannot reverse it. It's very difficult. Yes, but the other neuropathies, we discover them a little early, and when we can try and treat them or cure them, it is possible.
Okay. Chandy John wants to know, is numbness in the soles of the feet caused by neuropathy curable?
It can be reduced, yes. Neuropathy, like instance, once the nerve is damaged, it's difficult. But if that is beginning to start, that means the sugars have not been under control. And it's high time for them to control it. Otherwise, it will progress. Yes. Like I said, neuropathy is irreversible, but it can be controlled for sure and prevented from progressing if the sugar control is very good. Otherwise, it will increase.
Thank you for that. There are a couple of questions, one on the chat box and a couple to me about sweeteners. So like, the artificial sweeteners we get in the market, are they safe to be had? And are they acceptable?
I'm going to go up against the food and beverage industry if I talk about that now. Unfortunately, the verdict is still out on that. We don't know if it is safe. Okay. We don't know if it's useful also, right? We still don't have concrete evidence to say that, okay, it won't harm you in any way. We also don't have concrete evidence to say, okay, it will be bad for you. Don't do it. Okay. So either which way, we are not comfortable committing to this way or that way. My preferred advice to you is just stop the sugar. And the human mind is amazing. It will get used to anything that you want. So yes, even though we think, oh, we cannot live without sugar, actually, once we practice, it becomes easier as we go. So yeah. So the honest answer is the verdict is still out. I cannot tell you if it is safe yet.
The safest thing is to stop sugar. If
absolutely.
you're able to.
Absolutely. Yes.
Okay. Kanchana has said, aren't the numbers set by Big Pharma to gain profits? Even vegetarians and vegans can have high ID statins. Yeah, have, high LDL. Sorry, Kanchana, read that wrong. Statins have several side effects too, but doctors encourage patients to take them. So what's your view on this?
This is a very, very tough question to answer, although it seems very, very easy. Okay, so first and foremost, do vegans and vegetarians also get cholesterol? Of course they do. The cholesterol is not coming only from the meat. Yes, and in fact, people who eat a lot of meat sometimes have good cholesterol. They don't have bad, high cholesterol at all, because they're also working out. They're living in cold weather countries, and everything that they eat, the fat is getting metabolized. It's used for insulation against the warmth. So the concept or the idea that only meat eaters will get cholesterol is wrong. Because as Indians, the amount of oil we use in our cooking, that's all cholesterol. We also have cream, cheese, butter, dairy products that have cholesterol. So everybody, is working with cholesterol. We have a lot, egg yolk. Egg yolk is good, by the way. So a lot of people I see removing the egg yolk and eating. It's not necessary. That whole egg is good protein and cholesterol source for you, because your brain is entirely cholesterol. Your skin needs a lot of cholesterol. So in our body, there are many structures that need cholesterol. So don't have to cut out cholesterol from your diet. And vegans and vegetarians will also have cholesterol because they have cholesterol in their diet. Okay. Sweets, sugar, excess sugar will then get converted to cholesterol. Yes. So sugar itself, anybody who takes any carbohydrate excess is prone to get cholesterol. So these are all sources of cholesterol. So it's not just meat. So don't go around telling people stop meat, because for some people, meat may be staple diet, and it may actually be good for them. So that's the first part of the question. The second part of the question about statins. As a doctor, the only thing I can rely on is studies. Yes. So when I see evidence and research and I see, oh, statins are benefiting people who are getting heart attacks, statins are benefiting people who are getting strokes, and statins are useful for people who have high cholesterol level, I have to prescribe that to my patient. There is no evidence that says statin does not help. If there was evidence that statins do not help, then I will not prescribe it to my patients. That's the important thing. The conspiracy theory that big pharmas are pushing it comes because statins are slow-acting drugs. statins take a long time to act. Like if you want to have a meaningful reduction in your cholesterol, when you're taking statins, you have to take it for 6 months. It's not like you take 1 month and then go check your cholesterol again. Oh, it's come down. That is not appropriate. It has to be taken for 6 months and then go check your cholesterol after 6 months. And then your statins would have made a difference. That's because if you understand how pharmacology of statins works, then you will understand that it has to go into the cell and by there reduce the cholesterol pool and then reduce the blood cholesterol. So it takes a long time. So that is why these rumors are there. My advice to you is don't believe these rumors, okay? If your doctor is prescribing the statin to you, it's because they are backed by good evidence and literature, which tomorrow can change. But today's literature and evidence tells us the statins are good for people with heart attacks, strokes, diabetes, high cholesterol. So take the statins, don't stop them.
At NURA, do you test for neuropathy?
No, at this point of time, we don't test for neuropathy, but we are getting there. We are getting an ECG machine. We are getting an eye device, which will test for retinopathy. We're getting into abdominal scanning, but that is the way of the future. At this point of time, we don't check for neuropathy, but we have a doctor and you can tell the doctor your symptom and the doctor will check. She's a very good doctor. She's an MD general medicine and she will check you and then advise you accordingly. Yes.
Thank you, doctor. We don't have any more questions in the chat box. So if anyone has anything else to ask, do put it in the chat box. And doctor, if you would like to share anything important that you'd like to wrap this up with, since we have questions.
No, I think the introduction has been quite, how do you say, comprehensive. You know, I'm amazed. Like I always say, I always find the Silver Talkies group quite keen. They listen in, they ask the right questions. And as a doctor, I'm tested. I have to, really come out with all the knowledge that I have and answer it as, succinctly as possible to be able to get through those questions. So most of it about diabetes is covered, but diabetes is a disease that requires your willpower and determination. It's very easy to fall off the wagon because we are used to eating a certain way and behaving a certain way. The Indian lifestyle does not allow us to cut our sugars and sweets. We have a lot of festivals and functions. But if you can get past that challenge, if your determination and willpower can succeed, then diabetes is an easy disease to control. And most importantly, monitor and make sure you have the right lifestyle. And that's where you can beat diabetes before it beats you. So that's my final advice to everyone listening in.
Tabit says, is diabetes reversible? That's one question.
Diabetes, once it develops, is not reversible, unfortunately. But pre-diabetes is definitely reversible. Okay, so when somebody is in pre-diabetes, with good diet and exercise and lifestyle changes, they can become non-diabetic for sure. But if they have been pushed over the edge and they've become a diabetic, then it's difficult to go back because already their body is now telling them, I don't have enough insulin. I have some, use it wisely, right? So they can control it and then take some extra support and help, but it cannot be reversed, right? Like Sir said, they can come down to one medicine, but some sort of help will still be needed at the end. Absolutely. But best is to know if you're pre-diabetic and then reverse it there itself. And that's why regular screening helps.
Absolutely. Thank you for that. We are taking one last question from the chat box. So Saraswati has said that as on this date, I neither have BP or sugar and I'm living a normal life. But, what she's heard is that due to overweight, she may get diabetes. She's around 66 and wants to know if this is true.
It is true. That is why at the end of my presentation, I was showing something called as metabolic syndrome. So metabolic syndrome basically tells you your risk of developing diabetes or hypertension or heart attacks. And this is based on a few other criteria, like what is the HbA1c level, what is your visceral fat inside the abdomen, what is your HDL level that you have, what is the triglyceride level that you have in the body. I think these are 4 or 5 parameters that we use to check metabolic syndrome. If there are more than 2 of these parameters which are positive, then the risk of somebody developing diabetes or blood pressure or heart attack becomes on the higher side. So yes, can be normal now, but if we check and if we find some of this, then there is a risk. If we check and there's no problem, then you can be rest assured and tell everybody, no, I know my body, don't worry. I know that I will not get diabetes or hypertension. So better to check and be reassured rather than have that confusion where am I going to develop or not develop.
Mr. Arabumudan, difference between reversal and cure.
Sure, no problem. Cure is, let's say somebody has a fever and there's an infection, and then I can, give them medicine, kill the organism, and they're cured. They don't have the organism in their body anymore, and then they are fine, absolutely. Reversal basically means that in your normal physiology, something has become abnormal, right? Your body, which till then was able to handle the sugars very well, is now suddenly not able to handle it. And we will initiate measures that will then reverse that phenomenon and help your body handle the sugars better. So it's not like there was something that needs to be killed and now you're perfectly fine. We just make sure you go back to normal physiology. But if somebody still continues to insult their body by taking excess sugars, not exercising, putting on weight, then there's a chance that they can go back to the abnormal physiology again. So that's the difference between reversal and cure. Cure is you stop the causative agent and they're perfectly fine. Reversal is you take them back to a normal state of body, physical well-being.
Thank you very much for that, doctor. And thank you for being here today and explaining everything to us. Thank you for this talk. And thank you everyone for attending. Have a wonderful weekend. Thank you.